I'm Dr. Julie Bradford and I have a practice called Bradford Cosmedical, which operates chiefly out of Toowoomba in Queensland. I also visit the Wesley in Brisbane and the Gold Coast, and also visit some clinics in northern New South Wales. There is myself, and I also employ 2 other lady doctors who are injecting doctors, and I have a number of beauty therapists and a nurse. We also run an anti-aging practice, so looking at internal medicine as well as external medicine, so I have a naturopath who works with me as well. Our motto is looking good, feeling good, because if you're looking good, you certainly feel a lot better about yourself, and most people would agree with that. Troughs tend to appear in most faces around the 3rd or 4th decade. Some people develop some fat protrusion underneath their eyes as well, but can also appear as dark circles under the eyes. So by putting some volume back into those tear troughs, it can actually be quite a rejuvenating effect for people around the eyes, and even can help improve the dark circles under the eyes because of the reduction in shadowing. Mid-face rejuvenation is certainly very popular at the moment, but if you look at all the beautiful people in the past and present, all tend to have a nice strong mid-face. The classic young face and beautiful face has that inverted triangle, so they're much wider across and fuller through the mid-face and less through the chin area. Mid-face rejuvenation can augment a younger patient who doesn't have a lot of mid-face, but it can also certainly replace volume loss in an older patient who have lost volume through their cheek, and what appears to sag, but it's actually more of a loss of volume around the cheekbone area. So an extra volume through the mid-face will give that more youthful impression. Well, it does vary from patient to patient, so it's not a one-size-fits-all or even one area suits either. I think the patient needs to be assessed from a lot of different angles, so it's not just front on, it needs to be from the sides and also even from above to see where there is that loss of volume, because often it is asymmetrical as well. So I think the volume needs to be put where it needs to be put so that it's aesthetically pleasing, but generally it tends to be in this area here. But some people need more in through the more lateral cheekbone area as well as or instead of. So volumising in the tear trough, nasopharyngeal fold and the general mid-face area, and that can be anteriorly and also laterally to the side to give that impression of more width, can be achieved with both temporary and permanent fillers. The effect is immediate and the side effects are minimal.